Okay, so let's move on here to the ethmoid bone. And the ethmoid bone is another one of those centrally placed or centrally located bones. It's going to be a little bit more anterior in comparison to the sphenoid bone, but they're both very central in their location. So here's the sphenoid bone for reference. And then here's part of the ethmoid bone as well. So it's really in the center above the nasal cavity that we find the ethmoid bone. Important features found in the ethmoid bone are the crista galli, and that is this upward projection from the ethmoid bone. We can see it here on a sagittal view, and then we can see it here on this transverse view. And it's really compared to the comb of a rooster. So it's actually, it actually translates to a rooster's comb, and that's because of the shape and the location of this upward projection of the ethmoid bone. Another feature is the cribriform plate, and the cribriform plate is this horizontal plate that runs across. It's on either side of the crista galli, so it's running right across the ethmoid bone. And then we can compare that to the perpendicular plate, which is actually beneath the crista galli, and it runs perpendicular to the cribriform plate, hence the term perpendicular plate. So horizontally is the cribriform plate, and then vertically is the perpendicular plate. And again, we can better appreciate the perpendicular plate on this mid-sagittal view. The perpendicular plate also forms a part of the septum. And if you think about the septum, it divides right and left halves of the nasal cavity. And so that bone helps to form a part of that division. Other features of the ethmoid bone are the superior and middle nasal concha. And these concha are these spaces or kind of these wind turbinates that are found within the ethmoid bone. They help to make the head light. They also help to humidify air as air is breathed in from the external environment. And so the superior concha and the middle concha are actually parts of the ethmoid bone itself, whereas the third concha, the inferior concha, is a separate bone on its own. It's not a part of any other bone. Just to remind ourselves, these are paired structures, so they're found on either side of the nasal cavity. And again, these are concha. Concha translates to the word shell. And these are also turbinates that help to increase the surface area. They help to humidify the air that we breathe in. They also help to lighten the head so that the head is not made of all of this dense bone, but has some air or some resonance coming through. So again, we've got the superior and middle concha, parts of the ethmoid bone, and then the inferior concha, a bone on its own. Next is probably the easiest set of bones, the paired nasal bones. These form the bridge of the nose. Now, most of the nose is actually cartilaginous, so it's a cartilaginous projection that gives the shape to the rest of the nose. The tip of the nose is not actually bone. And so just the bridge of the nose is formed by the paired nasal bones. Next, we've got the maxillary bones. These are, again, paired bones that form the roof of the oral cavity, as well as parts of the floor of the orbit, the orbital cavity. Features that we see in the maxillary bones are the inferior orbital fissure. This is actually a shared feature. So if you remember us previously looking into the orbit of the eyes, or the opening for the eyes, and we saw two slant openings. The superior slant opening was called the superior orbital fissure, and that was found in the sphenoid bone. The inferior orbital fissure is a shared feature between the sphenoid, the zygomatic bone, and the maxillary bones. Okay, so the inferior orbital fissure is another one of those openings that we can see if we look straight into the back of the orbit. And then finally, we have the infraorbital foramen. Again, I'm going to compare this to the supraorbital foramen that we already spoke about, which was found in the frontal bone. This one is just below the orbit, hence the term infraorbital foramen. And it's obviously going to allow the passage of the infraorbital structures or vessels. Looking on the underside or an inferior view of the maxillary bones, we can see some other features here. We've got the tooth sockets, also called the alveoli or the superior alveoli. So the openings that allow the articulation of the superior row of teeth, we call it the superior alveoli or the superior tooth sockets. We also see the incisive foramen, so another foramen or opening that allows the passage of some important vessels. That's found right behind the incisor teeth, hence the term incisive foramen. And then finally, the palatine process is this shelf-like projection that runs across the maxillary bones, and it's really helping to form a large part of the hard palate. So the hard palate is what prevents contents of the oral cavity from going into the nasal cavity and vice versa. And so it separates the nasal cavity from the oral cavity, and the hard palate is formed mostly, not all of it, mostly by the maxillary bones. And a part of it, as we can see here, is formed by the palatine bones, which we'll talk about in a bit. Next, we move on to the mandible. So the mandible is pretty much the inferior part of the oral cavity. It's a singular bone, so don't get confused here. The maxilla are paired, but the mandible is a singular bone. And some of the important features of the mandible are the coronoid process, which is the anterior superior projection of the mandibular notch. We've also got the condylar process, also called the condylar head. This is an inferior more or posterior projection, again, of that notch. And then in between these two processes is the mandibular notch itself. This is the actual area that articulates with the temporal bone in order to form the temporal mandibular joint. Next, we've got the ramus of the mandible, and a ramus is like a connecting strip. We'll talk about rami in other parts of the body, but a ramus is kind of a strip that connects one area to another. We also have the alveolar or the tooth sockets of the lower tooth. So the lower row of teeth have or are located in the mandible, whereas the upper alveoli or the upper row of teeth sockets are located in the maxilla, the shared maxilla, or the paired maxilla, excuse me. And then finally, we have the mental foramen. Now, when we refer to the term mental, we're talking about the region that is involving the chin or the chin region. And so the mental foramen is allowing the passage of mental vessels, and it's going to be found inferior to the alveolar processes and in the chin region, and that's going to be that opening for the mental vessels. Continuing on with the mandible, we've got the mandibular notch. So we kind of described this earlier. It's that notch that sits in between the condylar process and the coronoid process of the mandible. We also have the mandibular foramen, allowing the passage of the mandibular vessels. Now this is found beneath the mandibular notch on the internal surface of the mandible. So this is an internal view where we can see the mandibular notch more clearly. And then we can refer to the angle of the mandible. This is where the mandible takes a turn. This is kind of the jaw line. If you palpate this on yourself, you can feel that sharp projection where your mandible has a sharp turn. That is referred to as the angle of the mandible. All right, moving on to the lacrimal bones. The lacrimal bones are these medial bones, often confused with the nasal bones. So don't confuse the lacrimal bones, also paired with the nasal bones. So the lacrimal bones are found internally, so they're going to be posterior to the nasal bones, and they're pretty much holding the lacrimal canal in place. So there's a lacrimal canal, which is the communication between the eyes where tears are produced, and those tears can drain down into the nasal cavity. And that communication is called the lacrimal canal, and it's kind of held structurally in place by the paired lacrimal bones in the area. And then finally, we've got the palatine bones. I kind of mentioned or introduced the palatine bones earlier. They're also paired, and they're found posterior to the palatine process of the maxillary bones. So here's the palatine process, which is the anterior part of the hard palate. And then posterior to that are these shared smaller bones which form the rest of the hard palate and lead to the soft palate. And these are called the palatine bones. So both the palatine and the maxilla bones together form the palate. Lastly, we've got the vomer. So the vomer is kind of the rest of the projection between the perpendicular plate. So here we see the perpendicular plate. Here we see the continuation of that separation that divides the left and right nasal cavity, and that is called the vomer, right? So if I were to ask you what bones separate the nasal cavities or what bones come together to form the nasal septum, you would answer the perpendicular plate of the ethmoid bone and the vomer. Alternatively, if I were to ask you what bones come together to form the palate, you would answer the palatine process of the maxilla bones and the palatine bone. So the perpendicular, I'm jumbling everything together. The palatine process of the maxillary bones together with the palatine bones, both of those structures form the palate. And that is all for this week. So be sure to study these structures.